The main types of SIBO are hydrogen methane, which we've been talking about, and hydrogen sulfide, which we won't be able to discuss. I'll just say a couple of words because in my experience, there's always a SIFO underneath the methane. There's often an overgrowth, or in many, many cases, there's always candida. And the mixed type, which is very common, involves archaea. The most important archaea, the most important little bug of the archaea is called Metanobrevibacter smithii, M. Smith, and he is the most important one. So the main symptoms of methane are constipation, bloating, and a tendency to gain weight. This was mentioned before, but now I'm going to show you that it's not just a tendency to gain weight. These patients clearly have a strong association with obesity, a tendency towards gingivitis or other oral issues. There is a strong relationship between periodontitis, gingivitis, and 2021 and archaea overgrowth or IMO. And well, we'll see later what the treatment is and what type of diet I believe is most suitable for this condition. Well, as we said, it's the overgrowth of a group of microorganisms called archaea, especially M. smithii, but there are also others, as you can see there, and only. About 33 to 36% of adults have enough methanogens to produce detectable concentrations of methane through traditional breath tests. And I tell you, I've read this, but they must all be coming to me. They must have all come to me because every time I suspect METHANE SIBO, and I swear to you, I see at least 10 a day. I'm not exaggerating at all. I really see at least 10. It's true that I practically ask everyone. My impression is that it's much more, but well, it must be that since I see obesity, I see microbiota, I see constipation, and I see thyroid issues, they all come to me. But well, these are the numbers. So as I was saying, these are the symptoms: excessive overgrowth of archaea in the small intestine, bloating, gas, constipation, but especially constipation, weight gain, or inflammation of the gums. But we also have brain fog. Brain fog is very typical in these patients. They also experience abdominal distension and flatulence, and sometimes I see this a lot, but I also see it in hydrogen SIBO and in hydrogen sulfide SIBO. In all three, intense itching, a lot of patients with itching, with lesions, the discomfort. In fact, dermatologists often send them to me to rule out hypothyroidism because hypothyroidism causes dry skin and itching. And every time I see an itch, I make a SIBO. And I would say that 80% of the patients I test for SIBO due to itching actually have it. How do we diagnose it? And I've just shown you, let's see, this graph is, and why? Because almost no one knows how to diagnose it properly, and that's a shame. Hydrogen SIBO is very easy to identify because it shows a peak, meaning there's a 20 millimeters of mercury difference from the lowest point on the graph to the highest point. In the first 90 minutes, a 20-point difference indicates hydrogen SIBO, but for methane, it's any point on the graph where the value is above 10 parts per million at any moment on the graph. It's not an increase. That is, if we start like in this graph at 25 and it stays at 25-30, well, there would be an increase of 10 here. But if there were no increase of 10 and it stayed at 25, 20-30 is methane. But also if we have 10, 12, 10, 15, 10, 12, 15, at any point above 10, especially if there are symptoms, that's SIBO. There are already many studies on this. This is a study presented by Dr. Javier Santos, who is a gastroenterologist and gave us the talk on SIBO versus dysbiosis in SESME. I liked it a lot. Thank you very much, Javier Santos, if you ever listen to this talk, because besides being very enlightening, you were so generous to share the slides. This is a study that shows quite a bit. It's a collection of other studies that demonstrate the relationship between methane and many diseases. And as you can see in the case of obesity, well, there are some studies that don't show it, but there are many, many studies, and most do show a relationship between SIBO and obesity. I'm going to skip the hydrogen SIBO because we don't have time. Can there be false negatives in the SIBO test? Yes, that's why I was explaining that it's very important to have someone who knows how to interpret this test. Okay, So I was telling you about the blind spots. Those are the blind spots when interpreting the SIBO test. And the key point is not to make our own interpretation of the test, because the person might have done the preparation correctly. There could be false positives or negatives, like I mentioned about methane, because labs almost always report it as negative, etc. Never forget the patient's symptoms, the preparation, the chronicity, and the communication. Communication not only with the patient, but often with the laboratory that's doing the testing. Let's talk a little bit about the treatment for SIBO. The treatment for SIBO is to correct hypochlorhydria with digestive enzymes, a little bit of apple cider vinegar, etc. It's very important to get out of constipation however you can. I usually recommend magnesium carbonate, but you can also use ozone, whatever works for you. Correcting constipation, of course, with a regular diet, the secretion of bile acids, okay? Eat calmly, slowly, etc. Spacing out meals, a low methane diet. In theory, the appropriate diet for these patients is still a low FODMAP diet. I don't give a strict low FODMAP diet because it confuses them a lot. It really confuses them. So what I do is mainly remove gluten, dairy, legumes that they can't tolerate well, garlic, onion, which they also don't tolerate very well, and all sulfur-rich foods, they really struggle with those. I remove legumes and then I leave. What I do allow is a little more fruit than in the strict low FODMAP diet, a little more vegetables as they tolerate them, and all the protein. That's what I do. I know that other people follow a low FODMAP diet, and that's it. All right, lifestyle is essential. Watch out for the B levels. Dr. Santos emphasized the other day that these patients often have a vitamin B deficiency that needs to be supplemented. And also, in my experience, it's very important to supplement vitamin D, which they almost always tend to have low. How do I treat archaeal overgrowth? There are two ways to treat it, either with medications, with synthetic drugs like rifaximin and neomycin, or metronidazole for 10 days, with herbs, using herbs and diet. There are always 3 pillars, or at least that's how I do it. I was taught a long time ago that the treatment for bacterial overgrowth, the treatment for dysbiosis, has 3 phases, which can be more, but basically it's clean, nourish, and plant. And cleaning is the phase of antibiotics, whether they're herbal, synthetic, and diet. Then nourish and plant, so that's things like quercetin, prebiotics. Finally, probiotics after many years of treating these patients. I start by doing a cleanse, giving herbal or synthetic antibiotics, but I also include probiotic because honestly, I've found that it helps a lot. And then there's the topic of biofilm, where my friend Mar is a mega expert, and I think she gives a lot of talks on it. We also need to address biofilm, and in patients with archaea overgrowth, it's important to tackle the biofilm issue as well. Basically, we do it with wormwood, but there's also bismuth, oregano, and so on. So, synthetic antibiotics, herbal antibiotics. I mainly use oregano in the slime, but I also use neem and thyme, etc. There's also garlic, but be careful because a lot of people can't tolerate it, a whole lot of people, and biofilm agents. Other products that are widely used for the treatment of archaea, and that caught my attention a lot, are berberine and red yeast rice with statins. And it's one of the things I mentioned here, interesting about the body. Or interesting about the body, or precisely for that reason. Red yeast rice and berberine work in diabetic patients or in patients with dyslipidemia. Maybe it works because it helps treat the archaea, but that's when I learned that red yeast rice, when I first heard about it, or statins were one of the potential treatments for archaea. I said, well, it's the same as cholesterol, which is one of the metabolic disorders in these patients with metabolic syndrome. I'm telling you, not as much as triglycerides, but still. And berberine is the same. Curious that berberine, which is a metformin-like and is widely used in obesity, metabolic syndrome, etc. So it's also a treatment for archaea, right? I mean, it all makes sense to me now. So what I was saying about my theory, this is a bit of why it's clearly clinically related. Constipation is much more typical in obese patients and patients with metabolic syndrome than in thinner patients. Archaea and constipation, methane. Well, we've already seen all the evidence from studies, right? 1, I've put here 4 or 5 of the hundreds, maybe not hundreds, but definitely quite a few more. The coinciding treatments and what I was saying, the relationship with intestinal candida from SIFO, which always underlies, or my experience often underlies the slime, and is linked to cravings for sweets. What does this mean? When you see a person walk through the door in your office, an obese person with these metabolic characteristics, probably with insulin resistance, constipated now, with a lot of abdominal bloating, craving sweets, feeling bloated all day, with brain fog, somewhat depressed, well, you need to do a study on archaea. Why? Because at least in my experience, and it's true that you change their diet a lot, you're going to say, of course, you take away gluten, you take away dairy, you take away sugars, so how could they not lose weight? But maybe these patients had already made all these changes and still hadn't lost weight. So it's important to treat the slime in obese patients, or at least rule out an overgrowth of archaea in the obese patient, because they can benefit a lot from it.